My name is Doreen. I am a Ugandan. I've been in India for 5 months now. I brought my niece for treatment, and I've been in a hospital for on and off doing cancer treatment. She has bone cancer. She's 15 years. She's called Sharon. I live in Sarita Bihar in India. But my experience about India is quite different from other parts of the world. I don't know, I've not been like to many parts of the world. There are many things. My niece does her treatment in another hospital, and I came in this hospital for little checkups. I was advised by a very good Indian friend of mine called Vivek. I did a dental checkup and eye checkup, and then I saw a gynecologist. Really, I didn't have a bad experience with the whole hospital. Everyone was understanding. They took their time on whatever they did with me. They took me through their machines, showed me a lot of stuff, what to do, advised me on what to do next, and how I'm supposed to go about with whatever I had come to do. Overview is, I liked the hospital. When I came in, it looked beautiful from a distance. It is clean. It is nice, though I didn't get to see like a black person around. Everyone was kind of Indian, which was really strange for me, but it was okay because they really attended to me. But again, when I look at things down here, things are really different. You see, in Africa, when you go for treatment, someone will come to you, they will see you, they treat you and tell you to go back. But review takes some time. But with this, I came, they did whatever treatment, not actually treatment, but every test I did was perfect, and the time taken was okay. Comparing to any other thing, really, it was really okay for me. But my biggest issue I have found in India is one, the biggest problem is English, especially with foreign patients. We speak a lot of, well, by the time we're coming, we speak a lot of English. We don't get to understand each other very well with the Indian community. And then to make matters worse, they tell you certain things, and by the time you get here, you don't get to experience them. You understand? And then when you look at this hospital, what is it called?
Pushpanjali
Crosslay. When I came to Crosslay, I don't know whether they have a marketing department or not, but surely to improve on your hospital and to get more patients from other hospitals, one, make sure you have a strong marketing team that properly understands the African setting. One, Africans are very rude people. They don't understand. If, as in, someone wants treatment, he's sick, he wants it to be done there and then, not taking time. This 5 minutes, 2 minutes is long. He imagines like his treatment is supposed to be done, and I can tell you one thing, an African will spend all the money possible to get the best treatment he can ever get anywhere. Even if it takes him like 80 million, as in 1,000 US dollars to get treatment, an African is willing to pay that money as long as he gets the treatment. But businesses of you take a little time, you slow down things, you do things, really is not the right way. You should adjust on that. Talk to them, tell them the procedures, what they are going to do. Feel that, really explain to them at a slower rate. Don't talk like the way you talk to Indians. Explain it to them in a slower rate, what procedures you're going to do, what it will take, the side effects, the after side effects. Let a person come in, receive him well, understand him, and they will understand you definitely. They will do whatever you really want them to do. And besides, when it comes to food, you should also act upon the food. You make sure you bring in if like a hospital, you bring in a continental chef who can do African styles of food, not strictly Indian. So if they say frying meat, you do the meat, you fry the meat. If they say boiling, you boil it. You just don't do it the Indian way because you're not sure. You make sure you get that. And also, search on the net. There are many African patients who are sick, who don't know where to go. But now I can assure you, I didn't know about this hospital until I came to India and until I met Vivek. If I didn't meet Vivek, I wouldn't know. But the only thing I can always tell him, and the only thing I've assured him, I'm like, Vivek, when I go back to Uganda, I'll make sure I'll send for you patients in case of any other sickness. I mean, I'm not only going to look out for cancer patients that brought me to India. There could be someone who has like a leg problem, he needs to fix his thigh bone, he needs to fix his knee joint, he needs to do anything, maybe a leukemia, any other sickness. I just tell him, don't look at a particular sickness. Africans suffer from very many things. So patients are going to come. I am willing to go and preach the gospel about this hospital. Thank you.